Erectile dysfunction is not automatically a sign of low testosterone, and understanding that distinction could tell you something important about your overall health. If you're experiencing erectile difficulties in your 40s or even younger, don't simply assume it's a hormone problem or something you should ignore. I'm Dr. Leah, and today I want to explain why erectile dysfunction can sometimes be an early warning sign that your cardiovascular health deserves attention. Here's why. The blood vessels supplying the erectile tissue are relatively small, roughly 1 to 2 millimeters in diameter, while the coronary arteries supplying your heart are larger, around 3 to 4 millimeters. When vascular problems begin developing, the smaller vessels may show signs of trouble earlier. That's one reason erectile difficulties can sometimes appear years before more obvious cardiovascular symptoms. So, if you've developed persistent ED, particularly at a younger age or alongside cardiovascular risk factors, don't just focus on testosterone. Talk with your doctor about whether your cardiovascular health should be evaluated. Depending on your individual risk, your healthcare professional may consider assessments such as a coronary artery calcium scan, carotid ultrasound, or metabolic blood tests. But here's where things become interesting. Your erections can also provide another clue. Ask yourself, do you still wake up with morning erections or experience erections during the night? That answer may help your doctor understand what could be contributing to the problem. Now let's clear up one of the biggest misconceptions about testosterone and erections. Testosterone is extremely important for men's health, particularly when it comes to sexual desire, energy, and maintaining muscle mass. But it doesn't directly control the mechanical process that allows an erection to develop. Think about one of the most familiar erectile dysfunction medications, Viagra. Does it work by dramatically increasing testosterone? No. It works through pathways that help support blood flow and the relaxation of smooth muscle in erectile tissue. Here's a simple way to picture what happens. Imagine erectile tissue like a sponge. If you squeeze a dry sponge tightly in your hand and then slowly release your grip, the sponge expands toward its full size. Something similar happens during an erection. The smooth muscle surrounding the erectile tissue relaxes, allowing more blood to enter and fill the sponge-like spaces. As those spaces expand, blood outflow is restricted, helping maintain firmness. And one of the most important chemical signals involved in starting that relaxation is nitric oxide. Nitric oxide tells smooth muscle in the blood vessels and erectile tissue to relax, so blood can flow in more effectively. So the bigger question isn't simply, is my testosterone low? A better question may be, is my vascular system producing and responding to enough nitric oxide? Because as men grow older, nitric oxide availability can decline significantly, and several everyday health problems can make that decline even worse. Now let's talk about nitric oxide, because this is where the real mechanism behind an erection becomes much clearer. As men get older, the body's ability to produce and maintain nitric oxide can decline. And when nitric oxide availability drops, blood vessels may not relax and widen as efficiently as they once did. But aging isn't the only factor. Several everyday health problems can interfere with healthy nitric oxide production. Poorly controlled blood sugar is one of them. Over time, elevated blood sugar can damage blood vessels and interfere with normal endothelial function. Smoking and vaping can also negatively affect your blood vessels. Then there's sleep apnea, a condition many men have without realizing it. Repeated drops in oxygen during sleep can place additional stress on the cardiovascular system. A sedentary lifestyle matters too. If you spend most of your day sitting and rarely exercise, you're missing one of the body's natural ways of supporting vascular function. Chronic inflammation and certain medications may also influence sexual function and blood flow. This is why I don't want you looking at erectile dysfunction as an isolated bedroom problem. Your erection depends on your blood vessels, nerves, overall metabolic health, and the chemical signals controlling circulation. So instead of immediately searching for ways to raise testosterone, look at the bigger picture. How is your blood sugar? Are you exercising? Are you smoking? Are you sleeping properly? Because improving the health behind your erections may be more important than simply trying to improve the erection itself. Now let's talk about exercise, because this is one of the most practical ways to support the blood vessel function involved in erections. And there's one type of exercise that deserves special attention: movements that recruit large amounts of muscle at the same time. Two great examples are squats and deadlifts. Why are these movements interesting? Because they engage large muscle groups throughout your legs, hips, back, and core. When those muscles work together, your cardiovascular system has to increase blood flow to meet the demand. That increased flow creates greater movement and friction along the inner lining of your blood vessels, which helps stimulate pathways involved in nitric oxide production. And remember why that matters. Nitric oxide helps your blood vessels relax and widen, allowing blood to travel more efficiently into erectile tissue. But don't hear deadlift and immediately load a heavy barbell. If you haven't exercised regularly, start gradually. A bodyweight squat, chair squat, or appropriately supervised resistance exercise may be a better starting point. Technique matters, especially if you have joint, back, or cardiovascular problems. The goal isn't lifting the heaviest weight possible. The goal is regularly challenging large muscle groups while staying within your physical ability. And exercise isn't the only thing you can change. Your everyday diet can also provide compounds your body uses in pathways related to nitric oxide. Now let's talk about food, because certain foods contain compounds your body can use in pathways that support nitric oxide production. One of the first foods worth discussing is arugula. This leafy green is naturally rich in dietary nitrates, which your body can convert through several steps into nitric oxide. Another option is beetroot. That's why you'll often see beetroot juice or beet powder discussed in conversations about circulation and exercise performance. Again, the important connection is nitric oxide and healthy blood vessel function. Then we have cacao, the less processed form of cocoa. Cacao contains flavonols that have been studied for their relationship with endothelial function and blood flow. But don't make the mistake of thinking that adding one food to your diet will magically eliminate erectile dysfunction. Look at the bigger picture. If your blood sugar is consistently high, you're smoking, barely exercising, sleeping poorly, or carrying significant cardiovascular risk, a spoonful of cacao won't erase those problems. Your overall eating pattern matters. Focus on nutrient-dense foods, manage excess refined carbohydrates and added sugars, and make choices that support healthy blood pressure, blood sugar, and body weight. Most importantly, if you're experiencing erectile dysfunction alongside cardiovascular risk factors, get evaluated rather than trying to treat yourself entirely through food or supplements, because improving nitric oxide is valuable, but protecting the blood vessels responsible for producing and responding to it is even more important. So gentlemen, let's bring everything together. Erectile dysfunction isn't automatically caused by low testosterone. Testosterone certainly matters, particularly for sexual desire, muscle mass, energy, and other aspects of men's health, but an erection also depends heavily on healthy blood vessels, adequate blood flow, and nitric oxide. That's why persistent erectile difficulties deserve more attention than simply searching for ways to increase testosterone. I'm Dr. Leah, and if you've noticed a significant change in your erections, especially if you're in your 40s or younger, consider discussing your cardiovascular health with your doctor. Depending on your individual circumstances, your healthcare professional can determine whether further evaluation is appropriate. And don't forget the everyday factors we've discussed. Poor blood sugar control, smoking or vaping, sleep apnea, inactivity, and chronic inflammation can all work against healthy vascular function. Then focus on what you can improve. Move your body regularly. If appropriate for your fitness level, incorporate large muscle exercises such as squats or deadlifts, starting gradually and using proper technique. Include nitrate-rich and flavanol-rich foods such as arugula, beetroot, and cacao as part of an overall nutritious diet. And remember, testosterone still matters. If you're experiencing persistent low sexual desire, loss of muscle mass, unusual fatigue, or other concerning symptoms, speak with your healthcare provider rather than diagnosing yourself. If you found this helpful, like the video, subscribe, and share it with another man who needs to understand this connection. Your erections aren't just about performance. Sometimes they're giving you useful information about your overall health.